So first we're making the surgical guide fabrication. So you're going to take a alginate impression, pour it up in Yellowstone, pick out a denture tooth that fits, and secure it with wax. Then you're going to take the temporary splint material, heat it up, and make a suck down. And from there you can take it out, take your tooth off, and mark the implant location on the cast along the central fossa of the adjacent teeth in the mesiodistal midpoint. Fill it in with ortho resin, take it off, and make some guide marks on your cast with a Sharpie, so that way you know where to drill. Then you're going to essentially drill down so that way you make a guide, surgical guide for the actual implant placement. So first we're going to theoretically check the seating, occlusion, and contacts on the master cast. And once you've checked, you're going to seat your patient and you're going to want to place a throat pack so that they don't swallow any of the small pieces. And you're going to theoretically remove the healing abutment from the patient. And you're going to place the screw with the driver in the abutment crown prior to placing it in the patient's mouth. And you want to finger tighten the screw using just only the driver and your fingers. So finger pressure, go ahead and use the screw there, screw it in. We're not using the torque at this point, torque wrench. So we screwed it in. And then you're going to want to make sure that there's sufficient contact with the floss. So you're going to just take a regular piece of floss and you want to make sure that you floss both contacts, mesially and distally, pull it through. Everything looks good. However, if it's too tight, you'll notice that it's not seating or that it's just, you can't floss. You want to use the quick check spray. So you take it off and you'd want to dry the surface and use this spray and then seat it again and check your contacts. So if not, you can use the ceramic wheel for porcelain or ceramic, or the greenie and brownie for gold. So once that's all seated, then you're ready to check if there's blanching. If there is, you want to wait for that to resolve. And then after that, after everything's good, contacts look good, you're ready to take a vertical bite wing. So you'll go in the x-ray room, make sure the bite wing shows that it's seated all the way, and check aesthetics as well. Make sure the patient likes the way it looks. At this point, you are ready to check occlusion with articulating paper. So have them bite down, check your contacts with occlusal paper, and adjust where necessary. So after the occlusion, then you are ready to fully tighten the crown using the torque driver. So you assemble the ratchet with the torque control device, make sure that the arrow on the ratchet is pointing toward the teardrop for tightening, and you want to make sure that if it's facing the wrong way, you just pull it out and flip it over and only use pressure on the teardrop to tighten. So once it's tightened, you're ready to temporize, and you're going to temporize using Teflon tape. You're going to pack it into the holes, and then you're going to use a light body PVS to temporize. So you're going to just go ahead and fill it up, wipe away any excesses, and then you're going to send the patient home and they come back. When they come back for the retightening, you'd go through the retightening process just as you did the tightening with the torque wrench, but then this time your final restoration is actually with the composite, and you're done.